Hello, my name is Jade Robinson and I am a healthcare professional. I'm currently studying my master's at King's College in London, and at the moment I am residing in Bermuda, where I was born and raised. Here in Bermuda, I've been serving as a frontline worker for COVID-19, volunteering and swabbing. In addition, I am a member of the Core Health group for Cov360. Today I'll be interviewing the leading physician for the Southside swabbing team for COVID-19 here in Bermuda, Dr Amne Osseran. In addition to interviewing some of our first frontline workers of COVID-19 here in Bermuda.
Hi, I'm Dr Amne Osseran. I am a general practitioner at a private practice. Over this COVID-19 experience or outbreak, I have served as the interim clinical director of long-term care, being responsible for patients in long-term care facilities who are exposed to COVID-19 and their management. I've also served as the clinical lead at the Southside drive-through. So I think to date, Bermuda has fared very well with COVID. When it first began, I think it was scary for everyone involved, not having gone through anything of this magnitude before. My initial involvement was actually in a rest home environment where we had almost the entire facility COVID positive, and I was tasked to assess those patients and just try to ensure that they were kept stable and identify anyone who had complications of COVID. And then shortly thereafter, we began opening this drive-through service for the management of testing for our country, which has proven to be quite a successful operation. And so I just think overall that our country really has done very well with managing COVID-19. I think that is really important for people to remember that we haven't fully characterized this virus, so there are still things that are unknown in the medical profession about it, which means that things can change daily. So it's important to just have that consideration. So the expectation for us to get everything right, or for the advice that we give today, for people to understand that it may change tomorrow, it may change next week. Also, I would love for everyone to remember that hand hygiene is paramount, and not just for COVID, but period. But it plays a significant role in the transmission of diseases. It's something that we often forget, even as healthcare professionals. We usually, during the time of hand hygiene campaigns, come out really strong and observe everything that we're meant to observe, but then it tapers off. So just reminding everyone that hand hygiene is important. So we're located in Bermuda. I function in the eastern end of the island. I would say COVID is more manageable today, but when it first began, it affected everyone's daily lives, right? The shelter in place meant that you couldn't move freely at all. But personally, it isolated me from my family. We didn't understand much about it, and so in the health profession, people who are intimately involved with COVID or patients with COVID isolated themselves to protect the public and to protect their families. So I hadn't seen my family, my children, for over a month, just over a month. We stayed in separate houses. I was following the protocols and instructions to remove clothes before going indoors and all of those dramatic things. I feel like we know much more now, and so none of that is currently being done, but it definitely is like an upheaval. Professionally, initially in private practice, it would have affected myself and colleagues as less people came to practice. They were scared to come outdoors. Now we have a good service in terms of testing, so there's that end of it all, where now we're doing more work trying to identify positive people in the community. So I think COVID-19 definitely highlighted the importance of emergency planning. No one was expecting this pandemic, right? So it just showed us that these policies and protocols, even if they seem meaningless at the time that you're creating them, really serve a good purpose. And we might not get them right at the time that we create them, but it gives us some sort of preparation for this unseen event. It also, for me in particular in Bermuda, we're a 21 square mile isolated island, right? And it just highlighted that we need to have confidence in the brains that we have on our island and the people that we've nurtured. We complete these degrees and earn these qualifications, and we compete on the world stage. And I just think that COVID-19 highlighted the need for us to believe in our own. Lots of countries relied on other larger countries for their direction. Entities like Public Health England or the CDC, WHO, and definitely not discounting the expertise of those agencies, but I just think that we also need to remember that we have expertise, and this is probably countries around the world. There are experts locally, and I just think that we should use opportunities to assist with recognition of that and growth of that and encouragement of that. In particular for Bermuda, we had Dr. Weldon, who is a specialist in PCR, who was able to return home and conduct our testing. I'm a young Bermudian as well, and I've overseen the sample collection and managed COVID-19 positive patients in long-term care facilities. And so I just think that we need to encourage each other and believe in what we can do, because Bermuda is now heralded for our intense screening program for COVID, and we did it here with local staff. I think one of the biggest challenges for our country would be supplies. We're a small, isolated island, and so we don't have manufacturing facilities for PPE or for the sampling equipment required for testing. And so worrying about how those things were going to get on island during a global pandemic when every country is in demand of it, that was a challenge. And then there's also the challenge of staff. Going through this, you have lots of people who may have been exposed and therefore sick. I'm talking about in the healthcare industry in particular. And then the need to replace or get people on board to operate in that capacity. Those things prove to be challenging. So in terms of how we tackled those challenges, I think in our preparation, just ensuring that we had the appropriate amount of supplies and foresight, estimating what we thought would hit our country and planning for that based on the things that were happening in other jurisdictions. I think in terms of our hospital and healthcare facility, we made those estimations and tried to tackle it by ensuring that community spread was as low as it could be, which meant that we sheltered in place. We had strict rules on when we could come out and under what circumstances, and the things that we had to do in public, like hand hygiene and masks. And I think all those things together helped to keep our numbers low so that we were able to contain it, because the challenge of supplies and staff and hospital space were at the forefront. Okay, I also want to add that the success of our drive-through and pop-up testing, which has led to testing of over 10% of our country and assisted with the containment of the virus, is largely due to the work of young Black Bermudians who gave up their time freely when it initially started. They came daily to swab and to greet persons who came for tests. And I think that ties in extremely well with the point that I made about trusting the local people and just embracing the expertise that's available on island. I think that's one of the things that COVID really has shown us, that you don't always have to seek outside validation. They've done a phenomenal job. They've collected the samples appropriately. They've been processed to the highest standards, and our country has just done really well. There was a brief period where we were down to zero active cases in our country, and then we opened borders with a rigorous testing regime, and of course when the borders reopened, we did have some imported cases, but our numbers remain low. And I do need to make sure that credit is given to the young Bermudians who are involved in testing every day. Alright, so these are some of the people who have worked with us from day one. Provided all the transport for our samples. His camera shy, but that was a really important part of the process, getting the samples from our pop-up and drive-through locations down to the lab to be processed in a timely fashion, and it's part of the reason that we were able to turn over samples within 24 hours, right? And these are two of our volunteers.
Hi!
All students.
Good day, my name is Toya Anderson. I am a frontline worker for COVID-19. I have been volunteering since April 2020. I am the youngest frontline volunteer worker here at the COVID-19 Center. So being in high school and also doing this, it has shown me that I have how to balance things in life. Also, it has made me more dedicated and hardworking. Also, it directed me to be more of a nurse, go on a nurse pathway. I enjoy helping and supporting my community.
Hi everyone, my name is Nia Daly. I am a student at Spelman College studying health science with the premier track. I have been volunteering at Southside in Bermuda for over 200 hours, and I have at least swabbed 300 people here in my community.
Wow.
I have had a really different experience with COVID-19 than most of the people in my community, as I've worked firsthand dealing with the virus in multiple areas in Bermuda and have been exposing myself and risking my life dealing with COVID-19. I think that I've been able to understand how viruses work a lot better now that I've volunteered, and it has strengthened my want to become a doctor and help my community. I think that's something I had overlooked a little bit before, was the compassion I have to have towards my patients, and being exposed to so many different types of people and what they may need in that particular community. For example, the Black community may need something different than the white community, and it's definitely showed me what I need to do as a physician to help that community and their specific needs. I think that's very important that a physician should have, and this type of experience has definitely helped me to get that.